Good afternoon and aloha. I wear my mask when I go out in public and when I go around a lot of other people. I'm taking it off just for this part of our press conference so you can hear me more clearly. There are three things I want to talk about today at this press conference. The first one is extending our stay-at-home, work-at-home order till May 31st of 2020 with modifications. The second one deals with partnering with our community health centers to do more aggressive rapid testing of COVID-19, which will allow us to open up. And the last one is talking about opening up our parks. Three, I think, very critical, important things as we find our way out of COVID-19 back to a more normal way of living. So with that, I do want to run through some of the statistics that you're familiar with today, was announced by the Department of Health, and I think some very good news. So we now have total cases of 586 cases, and on Oahu, 385. I do want to point out, this is the state slope, this is the city slope in blue. You can see the city slope is starting to flatten out. 2 new cases for the state of Hawaii, 0 on Oahu. This is the second day in a row now that we've had 0 cases for Oahu. It's an island with 1 million people almost, very close with each other, living on top of each other, very dense, and we have 0 cases. And that has to be to the credit of all of you out there. I mean, you really have been following the orders, the stay-at-home, work-at-home order, wearing of masks, practicing good physical distancing, protecting each other, starting with your families and your neighbors and your friends and co-workers and everyone else on this island. You've done an extraordinary job. We should be very proud of where we stand today. And we stand at the very best of the entire country. But it doesn't mean we relax our guard, that we go out and start doing things like we used to, because we'll see the virus come roaring back. So 437 people recovered. More have recovered now than the number of cases on Oahu. And that's good news. When you get COVID-19, for the most part, you recover. But you also can die. And now we have 12 deaths, 2 more today, or between yesterday and today. And again, we extend our heartfelt condolences to the family and friends and relatives of those who have passed away. So while many recover, people do die. And they're not all old people who pass away. We really want to protect everyone, starting with our kupuna, all the way down to our smallest little baby keiki. So it's critical, critical, critical that we continue to practice the social distancing I've described. If you could go to the next slide. So we just want to show new cases each day. State cases, you can see as it goes up and down, and you see on today it's very low with just 2 new cases. You can see the next slide. This is showing state cases with Oahu cases, and you can see they, we kind of mirror in some ways, but we see the Oahu cases really, really dropping. And then just the Oahu cases today, 0. Yesterday, 0. Okay, next slide. I wanted to talk also about why we think we could start opening up a bit. As you can see, since April 4th, the Oahu cases have been slowly dropping. The last 2 days, 0. Some other days close to 0. But overall, if you take this graph, these spikes up and down, you see a gradual dropping. We want to continue to see this, and this is why we find hope that perhaps we can start opening up our parks shortly. If this stays low, we can start looking at opening up other things too, in a phased way, keeping the order in place, but in a phased way reopening. And it's incumbent on all of us to keep it low so we can do the phased reopening. And if we see it start to spike up, then we have to slow down, stop, maybe step back, or move more slowly. But it's very good news in terms of this, where we are today. Next slide. So this is where we could have been. If you remember, on that Sunday in March, I think it was March, what was the date? March 16th, Sunday, March 16th, we had a press conference here in the atrium of Honolulu Hale. And we talked about what we expected to see if we did nothing. And we looked at the statistics both in the United States and internationally, and this was on a chart that was provided to us by the private sector, by one of our health systems, saying if you do nothing, Mayor, this is what you could expect to see in the state of Hawaii in the coming month and a half. Here we are, April 21st. Under this projection, we would have had 5,000 cases instead of a little under 600. 5,000 cases with 1,000 more on the way. And by the end of this month, just a short next week, we would have had 30,000 cases with another 10,000 on the way. This would have been a medical disaster. We would have looked like Italy. We would have overwhelmed our ICU rooms, and physicians would be making decisions about who lives and who dies, who gets a ventilator, and who's put out in the hallway. This was a wake-up moment. This is where we actually are. Here's the projection, but these two lines are both for US and for the rest of the world, and they follow each other. And here we see Hawaii and Oahu. State of Hawaii a little higher, Oahu a little lower. This is where we would have been. This is where we would have been. This is where we are. And again, this is through the action of all of you. And there's one other reason, and that goes to geography, the fact that we're so isolated from the rest of the continental United States. And because we're isolated by islands also, by our blue continent, we can really bend the curve, and we have. But despite seeing all of this, we're not going to be returning to a new normal anytime soon. This thinking that somehow, okay, we're out of the woods, we can go back. We're not going to return to the new normal. Not until there's new treatment therapies that are aggressive and really show that if you get sick, you're treated rapidly and you become well. And the end game is really a vaccine, which is they project 18 months away, 24 months away. I'm hoping more soon. But right now, until those two things happen, aggressive, very positive treatment therapies or a vaccine, we have to live in this new normal to keep this curve flat. So that's why we're extending the City and County of Honolulu's stay-at-home, work-at-home order, which would have expired at the end of April, till May 31st of 2020, with modifications. And I do think we should live to expect that in the future, the order will stay in place with further and further modifications. And at the end of the day, the order will disappear, and we'll return back to the life that we lived before the pandemic struck. And perhaps that will be when we get a vaccine. And I think at the end of it, the things that will take the longest to open up are large sporting events, large entertainment venues, those kind of things where we have a lot of people gathering. Doesn't mean in between we wouldn't see maybe sports being played, but we'd all be watching from afar, from our TV screens, but not in person sitting in bleachers. I hope that sooner than later we can get to that, but that's the expectation. Okay, if you'd go to the next slide. Just wanted to show, some bragging rights. Again, it shows different places. You got Taiwan that's doing really good, Singapore, South Korea. And I just wanted to show that in red here is Hawaii. And we're much better than some of these other places. And, we're kind of tracking Taiwan, which has done a very good job internationally. So it's something we should be proud of. Hawaii leads not only in terms of the United States, but we lead in terms of other countries around the world, some of them doing very well. So feel proud about it, but don't let up on what we're doing. Okay. So, in order to open up, I believe we need to do more testing, a lot more testing. A lot more testing. It's great what we've done. We've tested per capita more than almost any other place in the country. But we don't rest on our laurels. I think as we start to open up, as the mayors of each county start to loosen up a bit, as the governor starts to loosen up on his stay-at-home, work-at-home order, we have to test a lot more. We want to know as we do this, we don't see an increase of the virus and we end up with a spike and then we have to retreat. It's going to be very hard to take away things that we took away and have given back and then take it away again. So science is important. and testing is that science. And so even though testing is per capita very high, we need to do more. So I wanted to talk about this. You know, some of you may have read this past weekend, the New York Times did an article, a very extensive article, on a study by Harvard that showed, you know, this is the daily, average daily coronavirus test in the US. It shows the current level and what you need to do per 1,000 people in our country. So it's, excuse me?
100,000.
I mean, 100,000 people in our country, a 7-day average. The current level is 45 tests, and the level needed safely open per 1,000 people, 100,000 people in our country is 152 tests. If you go to the next slide. So they did it, they studied every state in our nation, and Hawaii is there. So if we go to Hawaii, you see, so Hawaii, the current level per day is 47 tests, average per day in the state of Hawaii, not just Oahu, but the entire state. So we need 152 tests per 100,000 people each day, which for the state of Hawaii, and for Oahu, that's 1,480 tests per day. That's a lot of tests. We may never get to that level. But if you want to know what the end goal is, what you should aim for to get the best baseline possible, we should be testing to that level. But what it does, for me, it reaffirms the fact that we need to do more testing. And while we're very grateful with the testing that's been done by the Department of Health and by our private sector, much more needs to be done. For me, I think it really is about not being passive, but being more aggressive. Not waiting to see if someone gets sick and then asked to be tested, but going out and finding who's sick. Because if you don't look for it, you can't see it. And if you can't see it, you can't prepare for it. And if we're going to start opening up, we need to be prepared for it. So we need to do a lot more testing. And I believe this testing needs to be rapid and aggressive. When we do it and there's a positive result, we contact trace and we find out where this person may have gone, and we talk to those people and we test them too, and we isolate the person who's tested positive. Or I don't like the word isolation. We wrap them in a cocoon of protection. We take care of them to get them better and to make sure they don't infect their other loved ones. And how are we going to do this? Because the City and County of Honolulu does not have a Department of Health. So we're going to be partnering with our community health centers around the island of Oahu. These are unsung heroes. Many people on this island may not even know about our community health centers, but they're out there in our communities around this island. There are 7 of them currently. One is not open right now. That's Wahiawa because of COVID-19 cases. But these community health centers in areas where they provide access to those in need. Many times they're underserved. They may not have a primary care physician, and they may want to be tested but have not had an opportunity to be tested. And so how do we help these community health centers to test more people in the communities that they serve? And so through the hard work of Guy Kalakukui, our Director of Department of Enterprise Services, who's going to talk, he was introduced to a group of people who could help us do this. But we're basically going to be purchasing test kits, approximately 10,000 of them in the very short term. We'll pay to have the test done at the community health centers. So we'll pay for the kits. They'll be delivered to the community health centers. We'll pay the community health centers to do the tests. And when the tests are finished, they'll be analyzed with a commitment of a rapid turnaround of 48 hours. Now, we wish it could be 24 hours. We wish it could be 12 hours. But we've gotten a commitment, a guarantee to turn it around in 48 hours, which is pretty quick for now. And then, of course, if there's positives or negatives, they'll be reported to the Department of Health. And those who test positive, they will be notified. They will go somewhere where they can be protected and cared for. If they can't be cared for in their home because it's multi-generational, where the city is prepared to enter into agreement with a small hotel chain in Waikiki that would allow people to stay in rooms for free for those who could not stay with their family. In addition, through the hard work of Guy Kalakukui and others, there's the personal protective equipment. Those are the face masks, the face shields, the gowns, the gloves, will be provided to the community health centers for free. We'll be delivering those to them. I know they've arrived. I don't know if, Guy, they've actually been delivered. But that's so those who are doing the test have the protection to do the test. In addition, we're going to be providing $20,000 to each community health center, the city and county will, so that they can develop their telehealth care infrastructure, so that they can talk to their patients online and not require them to come in to be talked to. So we're very proud of the fact that the community health centers have stepped up to say they want to work with the city, and we think this is a way to open up, and we'll continue to provide these kits and the backup support until such time as there's a more robust testing system put in place by other healthcare partners that are working on this as we talk. So before we go further, I would like Joy Monahan to come up and say a few words. You know, he's the council member from the Kalihi area. He's also chair of the budget committee, and he's the one who came up to the administration and said, I know of a program, turnkey operation, because again, we don't have a Department of Health or state hospitals, that could provide the type of testing that we believe needs to be done. The most forward-leaning communities around our country are doing exactly that, and he opened up this opportunity. So Joy Monahan, thank you.
Hello, everybody, and good afternoon. I'm just going to remove my mask just to speak to everybody here today. First of all, I wanted to thank the mayor and the administration, as well as our partners in our healthcare partners who are going to be administering these tests, and also they came to us by way of UPS, who happens to be in my district, and I've had a relationship with them for a long time. And I wanted to give a shout out to Bruce McCrae, who's actually in Los Angeles, and he brought this program to my attention. And so this is all in a matter of maybe a week or just a little over a week that we were able to put this all together, and we're rolling it out here today. So it's been really, truly amazing, and I really want to thank also Director Guy Kalakukui for working very quickly to do this. But, you know, for me, I'm very happy that we're not only going to be able to provide more testing, but really testing where we need it to happen. You know, these at least the health centers in my district are in the heart of the urban core, right? The densest populations live around these health centers, and we haven't tested there at all. And so I'm very concerned that we haven't done that already. And despite our best efforts to date, and you know, we've only been able to test really about less than 2% of our entire population. So these tests are really welcome and much needed. So I'm very grateful for that. And you know, if we're going to start lifting restrictions slowly and gradually, you know, we really need to ramp up testing to be able to know that we can open up safely, and you know, and there's no way we can do that without the data. And so I'm very grateful again for this partnership here today that we're rolling out with UPS, our health centers, and the city and county of Honolulu. So with that, I just wanted to call up Will Cunningham, who's here from UPS, and just to say a few words. Okay, thank you, Mayor.
Thank you. And again, my name is Will Cunningham. I'm the UPS Hawaii Package Operations Manager. And I want to start this off by saying UPS is at the front line of this pandemic with you. Right? We are operational in Honolulu as well as the rest of the islands, and we'll be here for the community to support the community for whatever they need. You know, when the pandemic started, UPS was working behind the scenes with different healthcare providers, looking for partners that could help streamline the process of testing. UPS, along with Everlywell, will work with the city of Oahu, the island of Oahu, to help streamline the processing. We are going to help organize the sending of testing kits out here to the island, as well as we're going to streamline the process of getting them back to the mainland to get the results. We are also going to help provide personal protective equipment to the ladies and gentlemen on the front line at the healthcare providers to ensure that they have what they need to conduct these tests. We are going to be here. We'll always be here to support the community, and if you guys ever need anything, we're here to support the state and the city of Oahu. Thank you.
Yeah.
Just one last thing about UPS.
Just practice good social distancing.
Yeah. Sorry, I forgot to mention, just one last thing about UPS. So, in my conversations with them, they've been truly amazing, real great corporate citizens. Apart from helping us with this program, they've also donated 20,000 N95 masks to our first responders who actually we were having trouble procuring. I got a call from the deputy chief of our fire department, and he told me that, we had recently lost a bidding war against the state of Utah, who had much deeper pockets. They were bidding $300,000 for a single lot of personal protective equipment for the departments and our first responders. And here comes the state of Utah, and they bid about $1 million for the same lot. So we're having to compete nationally against states or other states who really have much deeper pockets. And so what UPS did was they stepped up. They not only donated the masks, but they're also helping us with procurement to be able to help our first responders. So again, I wanted to thank you again for that. And again, shout out to Bruce McRae. Thank you very much.
Can you introduce Guy Kalakua?
Yes.
Yeah.
And so with that, I wanted to introduce our director who's going to be spearheading this program, Director Guy Koulukukui. Thank you very much.
Thank you for the opportunity to address you, and I wanted to also thank Will and UPS and Councilmember Monahan for bringing the opportunity forward to us. And it feels like a week, but actually I think it was more like 2 weeks or 2.5 weeks that we've been working on trying to put this together. It has been quick and rapid. It couldn't have happened without some of the folks who spoke already, without the mayor's leadership, and in particular without the community health center's desire to participate and to evaluate our program and expand our reach of testing into the community. I think one of the things I wanted to say is that beyond helping the community centers help their own communities and Oahu by extension, we're trying to help the centers themselves, who are all struggling a little bit right now, in some cases quite a bit right now, as they've lost revenue as a result of this pandemic. As you can imagine, patients cannot, in some cases, or will not in others, come into their centers. And when they don't come in, they don't get the treatment that they potentially need, and the health center's business model is drastically impacted because of their inability to get reimbursement payments for services. So it's one of the reasons that we want to do the testing with them, as well as the reach that they have in the community, because as the mayor indicated, we are planning to pay them for the testing, which is something that some of the centers are doing right now, but that is a pure expense for them, as it's been explained to me. That is not a necessarily reimbursable cost. So we want to accelerate the testing in places where it's also happening and expand it into the parts of the community where it's not presently happening. Again, we're very grateful for the opportunity to be able to work with them. We have 4 representatives here today that will have some things to say and share with you, and they'll be available to answer questions from the media as we conclude. I'm going to invite first Dr. Rediger from Kalihi Palama Health Center, and then I'm also going to ask him, because it's going to be easier for him to, when he is done with his comments, invite his other colleagues up. It's far easier for you to recognize them with masks on than it is for me. So I appreciate if you would do that. Thank you very much.
Good afternoon. The patients that we serve are very vulnerable patients. I think that you've heard about how certain components of the population are more at risk from this infection. We all know the elderly are particularly hard hit, but we've also heard about certain demographic groups that are particularly vulnerable because of their socioeconomic disadvantages and their high rates of comorbidities of diabetes and other things. And these are the populations that we serve, our minority populations, our sick populations. So, you know, we are very grateful to be able to serve them. We're also grateful for the help that we're getting, the recognition that we can use extra help. And many of these things that the mayor talked about are going to be very helpful for us to do our job. Personal protective equipment, of course, increased testing. We all know that this is going to be a part among many parts of stemming the tide of this epidemic. The ability to do distance medicine, it's going to be very helpful to protect our patients, and we're trying to roll this out and do this in an effective way. And then there was a fourth one. Oh, what's really exciting is this idea of quarantine hotels. You know, a lot of our patients, they get out of the hospital, they're still infectious, or they go home from the emergency room with a diagnosis, and they're told, well, you need to stay in your own private room with your own private bathroom and have somebody bring you a meal 3 times a day. And, you know, for our populations, that just doesn't work. So I think this is an exciting thing. There are many facets to this, stopping this pandemic and protecting our people and making them whole again. And I'd like to commend the leadership for, you know, courage and vision and the initiatives that they're taking. So, Mia from Waianae Coast Comprehensive Health Center.
Yeah, if you could have said your full name for the press when you get up there. Thank you.
Aloha, good afternoon. I'd like to take this opportunity to really thank the mayor for inviting us here, for recognizing the important work that our federally qualified community health centers do for the community and for Hawaii. I'm Via Segal. I'm a physician, a pediatrician by training. I'm also the Chief Quality Officer for the Waianae Coast Comprehensive Health Center, where I have worked for the past 26 years. As you may know, Waianae Coast is the largest of our 15 community health centers. We serve a population of over 40,000 through about 250,000 visits a year. We are very quick to react to this pandemic. In already early mid-March, we canceled all non-essential visits, and as Guy had indicated, that we took a very precipitous drop to our revenue as well as our ability to provide services. We have been, over the course of time, transitioning using the miracle of telehealth and are now up to 65% of our operating capacity. So we are very, very grateful for the initiatives that the mayor has been making to support our telehealth services and continue to do that. And it's been wonderful for our patients to really transition to this new form of providing care in these uncertain times. We're also very grateful to the mayor for his delivery, or the delivery of a lot of personal protective equipment yesterday at our health center. We're very, very grateful for that. We have had a hotline set up, a COVID hotline set up for the past month. It's open 7 days a week, feels like 8 days a week, patients can call in from all over. They do not have to be our patients. They do not have to be residents of the Waianae Coast. I'm sorry. Oh, I don't have the number memorized. I'll get it for you. I will get it for you. So with that COVID hotline, patients can call in, people can call in and ask whatever questions they have, if they're worried, if they have symptoms, if they have any questions. These hotlines are staffed by registered RNs and APRNs. We also have a drive-through testing site set up, which has also been in operation for over a month now. And this has been a very successful mission of ours, and we have provided over 650 tests so far. Fortunately, and I do have wood to knock on, we've only had 4 positive cases, which is really, really fortunate, and we are delighted by the graphs which the mayor showed earlier today, and really hope that a lot of the initiatives that the state, the mayor, and ourselves have put into place are really, really working. That being said, we are nowhere near out of the woods yet, and we need to continue doing what we're doing. We are excited by the expanded testing initiative that the mayor has proposed, and currently we are investigating how we would incorporate this into our existing workflow, where we are already testing our patients and doing very aggressive contact tracing and follow-up. Anyway, thank you very, very much. Let's all stick together, wash your hands, and social distance. And what is this?
Can you read that? That's the
Ah,
number.
here's the number, 697-3170. 697-3170 is the COVID hotline. Feel free to call it. We will take your call, no matter what part of the island you're calling from. Aloha and mahalo.
So,
Oh, I forgot to introduce.
you want to introduce him? Or-
It's my pleasure to introduce one of our favorite colleagues from Waimanalo Health Center, Desmond. I don't even know your last name, Desmond. I'm sorry, we just met today. Dr. Desmond from Waimanalo Community Health Center.
Dr. Desmond, maybe you can say your last name.
Good afternoon. My name is Desmond Fu. I'm representing Waimanalo Health Center. I first off want to start by echoing the sentiments of Mayor Caldwell in that we are all in this together, and I really see that we have all done a terrific job in protecting each other. Now, moving forward, of course, Waimanalo Health Center has also had to adapt to this global pandemic. Likewise, with the other health centers, we are offering telemedicine, as well as actively testing our patients. I want to commend, again, the leadership in their vision in seeing that testing is a clear necessity in order to treat and as well as diagnose what is going on in our population. As well, of course, having the appropriate personal protective equipment is essential. I do want to give a great shout out to our partners as well as those on the front lines in the emergency rooms, all the support staff, to my physician colleagues, as well as all the other medical help and support system that comes along with that. And last but not least, as we roll out these different initiatives of testing, as a scientist and a physician, I must say that we have to be careful on what each test means, how to order a test, and of course, assessing the properties as well as knowing what that test tells us and what to do with that information. As such, Waimanalo Health Center will, of course, be a key part as in providing tests, as well as trying to reason out what these tests are best used for, and are happy to support the mayor as well as the city of Honolulu. Thank you so much. I want to introduce Janelle Ahuna from Waikiki Health Center.
Good afternoon, everyone. I'm Janelle Ahuna. I'm the Associate Medical Director from Waikiki Health Center, and I'm a physician assistant. When this all started, we likened it to kind of changing the tires on a moving car. And since this has been present, you know, a lot of, as I echo the sentiments of the colleagues that spoke before me, we all had to kind of scramble, and we're understaffed, and we're already, you know, wearing many hats at this at our community health center. But our one main goal and mission is to serve our community and our patients for Waikiki Health Center. It is varied. We have persons living with HIV, hepatitis C, homeless people, homeless persons, and persons of our shelters. And so we have a very varied community base. And one thing that we want to continue to do is to see our patients. So that means proper PPE, doing our triage tents, and making sure that our patients are safe when they're coming in if they cannot access telehealth. And on the fly, we've had to rapidly develop our telehealth telemedicine program. And so we're delighted to share the opportunity to get further testing options or opportunities for our patients that already have a lot of barriers to healthcare and to their everyday life. So thank you for having this opportunity for us, and we look forward to partnering with the mayor and our other community health centers that will be looking to expand testing for our patients. Thank you.
Thank you. I'd just like to also follow up. We had a fifth actual physician who was going to join us and actually got all the way to Honolulu before she got a call. It's Dr. DeVilbiss from Kokua Kalihi Valley. Got a call to head to the hospital, and assist a mother to give birth this afternoon. So we're really kind of excited about that. And I know she was a little bit disappointed, but also grateful that she had the chance to be here. I just wanted to take a few more words to wrap up, and thank you again to our participants from the community health centers. This is a project that the city is funding, and we're funding it because it's an investment in our community, and it's incredibly important. It's the only way we can reasonably open our economy without just guessing what is happening out there. We really need the data in order to do it, and that's where we're headed through this program. On a daily basis, across the state of Hawaii, we're losing millions of dollars of tax revenue every day. What we're going to spend on this program is just a fraction of that, but incredible in its ability to help us recover as a community, which is something we really need to do smartly, rapidly, and strategically. And again, with the direction from the mayor and the assistance from the community health centers, we're going to be able to do that. We're in the final processes of crossing the T's and dotting the I's with each center. We're hoping that we will be instituting or administering through the health centers the first tests as early as next week. There's a training program that UPS and their partner Everlywell conducts with the health centers online, and we're looking to get that going this week so that the program can deliver on all of the hopes and desires that we have for it. So again, thank you to the doctors, and I'm going to call, I think, Mayor Caldwell back up.
So I wanted to thank our partners from the community health centers for coming here today from various parts of the island, some pretty far away. And as you were talking, I thought one other thing, we want people to get tested who are concerned about their health and meet the criteria for each of our community health centers. And one thing I do know is that these health centers have trust in their communities. I think people who may have been offered testing in other places, it's not their community, it's not their physician, it's not what they know. But they know the community health centers, and they've been there for their communities for a long time to come. So my hope is that as the city provides these tests, and we're going to be spending $2 million to have these, to purchase the kits and to pay for the test to be done. And we think it's a small price to pay. Guy mentioned millions of dollars of loss. I mean, we went from a tourist industry of somewhere around $15 billion to zero. And if we can spend a fraction of this money to know where the pandemic is and where it isn't, and then to fight it, and to make sure those who are sick are cared for, and we keep the curve flattened, and we can continue to open things up, that small investment can pay gigantic dividends. Another thing it pays, no matter how you measure it, it saves a life, or two, or three. And how do you measure that? So we're spending $2 million to do about 10,000 to 13,000 tests, somewhere on that line, and we probably will spend more if necessary, out of funds that the city has. So with that, I did want to go into the next phase, and that is criteria to modify the stay-at-home, work-at-home order. The reopening. I know many people are probably watching this and thinking, what about us? We're unemployed, we have no paycheck, we're waiting for an unemployment insurance check to come in. Maybe we got a PPP check from the Small Business Administration, but we need to pay our rent, we need to pay our mortgage, we need to feed our family. And how do we get back to work? And I know the governor, state of Hawaii, and all the mayors want all of us to get back to those lives where we're working and living like we used to. But it's not as easy as just coming out. We go back to where we were. You'll see that spike that you saw on the charts, and we could be in a very bad situation and have to retreat. We don't want to do that. So how do we come out? It's partly the testing, and it's slowly opening things up. So as I mentioned last week, we have criteria to modify the stay-at-home, work-at-home order, and there's 4 categories. And the first one is epidemiology. It's, trends of decreasing cases despite increased testing. We saw the charts in the beginning of this. That is showing the trends. That gives us the ability to say maybe we can start loosening things up. Test, test, test. stays low, we can keep opening things up. Test, test, test. Goes up a bit, we step back. And then the healthcare system, you heard from our healthcare providers here. They are heroes. They're on the front line every day. And we want to make sure that the system can handle the existing patient load and prepared to handle increases. I mean, if we open up a bit and we get a little bit of a spike, we want to make sure there's sufficient ICU rooms, we want to make sure there's sufficient ventilators, we want to make sure there's sufficient PPE. And all of those things are assured right now. But we've got to keep watching it as we open up. And then our public health system ability for DOH to immediately conduct contact tracing. And they've ramped it up. They have volunteers, 30 or so, and they're getting ready as we open up and as testing goes on to make sure that we're finding out where the virus is and where it isn't, and we can then start to even open up more aggressively. And then the social readiness, that is dependent on all of us. At the end of the day, are we going to continue to wear a mask for a long time to come, which I believe we will? Are we going to continue to practice good, not social distancing, but physical distancing, far apart from each other, 6 feet, 10 feet? Socially, we can be close, a phone call away, a text away. We can show our love to each other. We just can't do it close together in a public setting. So if we can do this, we can continue to open up. And that's the criteria. And so, next slide. It's this balance. What do you open first? How do you compare the cost of each of the measures with the benefits that they bring? And it's a little bit of a scale. The cost of doing it and the benefits they bring. And last week on Thursday, we met for the first time with a group of medical advisors put together by Hiro Toya, our Director of Emergency Management. He reached out to the private sector and gathered a group of 5 people, physicians, psychiatrists, who are advising the city now on how do we deal with the pandemic and how do we begin the process of opening up. And they advised the first thing that we should open up are our parks for exercise. That people are been cooped up, they feel anxious. The only thing they can do now to get exercise is to walk or run on a sidewalk in a city street or state road. It's not ideal. And that if they could see some light at the end of the tunnel, see some hope by going into our beautiful parks where they can, feel the sun and the wind and maybe even some rain and exercise for their own mental health and physical health, it'll make a tremendous difference. It's one of the things we're choosing from the menu of options. And so parks are first. So we're going to be opening up our parks for exercise only. For exercise only, starting this Saturday, April 25th at 5 in the morning. That's when our parks open. So it's coming this Saturday, April 25th at 5 in the morning. You can go into the parks to exercise only. Now, what does that mean? It means the parking lots will be open so you can drive into the park and park to do your exercise. And exercise means running, jogging, walking, and bike riding only. It's not about having a picnic, no large gatherings, no gatherings. We really want it to be you going into the park, practicing good social distancing, wearing a mask if at all possible. I try to wear a mask when I'm jogging in Manoa. It's kind of hard, but it's possible depending on what kind of mask you wear. So it's up to you to decide, but if you're walking, for sure you can wear a mask and practicing good social distancing. So parks are going to be open for running, jogging, walking, bike riding only. It's not going to be open for basketball or baseball or volleyball or tennis or lawn bowling or pickleball or swimming in swimming pools or the gyms. So this is all about physical distancing. It's kind of hard to be physical distance if you're playing volleyball or basketball, even if you tried, because you're going to be bumping into each other. So these kind of contact sports or sports with balls and those kind of things will not be allowed for now. It doesn't mean it won't happen later, but for right now, this is the first step of opening up. The other thing is we're not going to allow the use of the playground equipment, the jungle gyms, or the exercise equipment. And again, as our physicians have told us, the COVID-19 virus could settle on some of these things, It may not be there for long, but long enough as some keiki goes and climbs on something and touches it and puts their hand into her mouth like kids do, or his mouth, there could be a problem. So exercise only, and you can't use things like play equipment, jungle gyms, exercise equipment until later. And we hope that this will make a tremendous difference, and then we'll look at other things. So this is this coming Saturday. We'll test with our community health centers, more aggressive testing. We'll look at the testing already be done. And if we see the rates being down here, we will continue to look at opening up things as we go further. And, you know, it could be things like car dealerships for appointments only in showrooms. It could mean real estate transactions, you know, open houses, but appointment only. It could mean small retail under 50,000 square feet, only half the capacity of the store under the fire code. Clicking in, everyone wearing masks, both the employees and the customers. And then we continue to open up, but every phase of the opening, we are testing aggressively, working with our community health centers and perhaps others as they gear up on the testing. And all of it is done. All of this is done with kind of some kind of mask covering and physical distancing. This is going to be the new normal for a very long time to come. Since I'm talking about masks so much, I would like next to have Aviela Weltman come up and talk. She is helping put together some efforts on the part of mask wearing, and she is a VISTA volunteer with the Department of Emergency Management. Is doing an incredible job. Landed on her feet right before the virus struck, and she's working almost every day of the week. Aviela, come on up and say a few words. Thanks.
Well, hello, Mr. Mayor. Aloha, I'm Aviela Weltman with the Honolulu Department of Emergency Management. We're launching this Mask Up Oahu and COVID Kokua campaign to highlight innovative efforts of our residents and local businesses to stay safe and healthy. Residents, we're asking you to show us your creative and homemade face coverings by posting on Facebook, Twitter, and Instagram using the hashtag MaskUpOahu. Businesses, show us your inventive solutions to keep people safe. We're asking employees and customers to share pictures or stories of best practices that really stand out. Post these on Facebook, Twitter, and Instagram, and hashtag COVID Kokua. And don't forget to tag the business. We want this campaign to highlight the outstanding work of our residents and essential businesses and what you've been doing over the past few weeks. Additionally, businesses, you can visit oneoahu.org/business-guidance for more information on best practices to keep your employees and customers healthy. We can only plan and coordinate so much, but it will be the hard work of our residents and essential businesses to help us through these challenging times. Mahalo for all of your hard work in Kokua.
Hello, everyone. So at this time, we'll ask reporters to begin submitting their questions, and Mayor will give some closing remarks, and then we will